Hi, my name is Rachel Taylor and I am here to present a presentation on human immunity. So let's start by talking about infections. What is an infection? An infection is caused when a pathogen enters the body and it can result in a fever or other health problems depending on where it occurs in the body. If the pathogen does not infect the body, the immune system will defend the body from infection or disease, and the immune system will fight the pathogen to destroy it and protect the person from illness. Now we will look at each infection. Bacteria is known as food poisoning. A virus such as influenza or COVID, a fungi infection such as thrush or athlete's foot, a parasite such as tapeworm or malaria infections. Pathogens can be transmitted from one person to another and by a pregnant woman who can spread pathogens to an unborn baby via the placenta or via breast milk. Pathogens and pathogens. Another way to spread infection is by eating contaminated food and water. And animals and pets are another way of catching and spreading disease and infection. So, how does the body defend itself? The body has a specific and non-specific lines of defense. Let's look at non-specific defenses. The first line of defense are chemical and physical barriers that do not distinguish between a specific pathogen and they act in the same way whatever type of pathogen it is. Now we will talk about the different barriers which protect the human body from infection. Here's one of our first physical barriers we have, and that's our skin. Pathogens cannot cross the skin unless we have a cut, then the pathogen can pass through. The skin creates a watertight mechanical barrier that serves as the body's primary defense. We also have glands in the skin that secrete oil which kills microbes. The nose, mouth and eyes are obvious entry points for pathogens. However, tears and mucus and saliva contain enzymes that break down the cell wall of many bacteria. Those that are not killed immediately are trapped in the mucus swallowed, and special cells line and protect the nose, throat, and other pathogens within our body. We have very small fine hairs called cilia, and these hairs are usually found up your nose and in your windpipe. These hairs help to track pathogens that have tried to enter the body, and once the body has recognized the pathogen, the body will react by coughing or sneezing and blowing the pathogen out the nose. And stomach acid kills bacteria and parasites that have been swallowed, and that's the final first line of defense is a urine flow, flushes out the pathogen from the bladder area. The second line of non-specific defense mechanisms involves a response within the body, and if the pathogen can get past the first line of defense, for example through the cut in your skin, and an infection develops, the second line of defense becomes active. And the second line of non-specific defense mechanisms involves a response within the body and the pathogen can enter it. An inflammatory response is the body's first response to infection, and the blood supply to the area affected will increase so that the cells can destroy the pathogens and can reach out to the area quickly. And there is also an increase in the temperature in the area, and this may react by being red or swollen. As the pathogen are destroyed, a pus is formed and then broken down. So let's take a look at a fever. For example, a fever may develop in the rest of the body as some pathogens cannot live above a certain temperature and are destroyed. The cells found in the blood are generally known as white blood cells. There are several types we have, which are neutrophils, and these are cells that can move by a process of chemotaxis through the blood vessels and are usually the first cells to arrive at the site of inflammation or infection. The cells force the invading organism via phagocytosis, and then using force again, the enzymes destroy the pathogen, and the cytokines release chemicals which are used to attract other immune cells to the area, and other small proteins called complement proteins which can destroy the pathogen. Cytokines can cause a cascade reaction, and they stimulate the production and release more cytokines. And there are different types of cytokines which target different immune cells within the body. So moving on to monocytes and macrophages. Now these cells are found in the blood, and once the monocytes arrive at the infection site, they undergo changes and then they become macrophages. These force pathogens via phagocytosis, and once ingested, enzymes inside destroy the pathogen and foreign particle. Monocytes arrive at the infection, they undergo changes and become the macrophages. Pathogens are engulfed via phagocytosis. Enzymes destroy the pathogen. Some macrophages can destroy dead or damaged cells, and macrophages are found all over the body. So let's take a look at antigens and pathogens. If the pathogens such as bacteria and viruses manage to invade the non-specific immune response, they will come up against our third line of defense. There are some situations that innate immune system can't handle. For example, there may be too many bacteria, or the bacteria might multiply too quickly. That's when your adaptive immune response or third line of defense kicks in. The third level of your immune system consists of cells made to get rid of the specific microbes that have invaded your tissues, and special cells called dendritic cells are the liaisons of response, point of communication between innate and adaptive immunity. They travel to the site of infection where the phagocytosis and break off into small parts of the pathogen. They carry these parts to your lymph nodes where the adaptive immunity begins. The adaptive immunity responses involves two main types of specialized white blood cells called lymphocytes, B cells, found in the blood and produce antibodies. Immune globulins, also known as antibodies, are glycoprotein molecules produced by the plasma cells, white blood cells. They are a critical part of our immune response by specifically recognizing and binding the antigens, such as bacteria or viruses, and aiding in their destruction. And they work with T cells, and body makes millions of different T cells. Each of the T cells can recognize a different type of pathogen, and this means your body can combat almost every invader, even the ones it's never seen before. Memory T cells remember pathogens seen before. They help your body launch quicker and more effective defense in the next time around. Cytoxins T cells destroy any of your own cells that have been infected with a virus. T helper cells help other cells such as B cells, often by releasing proteins called cytokines. And these proteins bind to other cells in your body and tell them how to strengthen the immune response. T regulatory cells. They shut down an attack by other immune cells, and once the pathogens have been cleared, this stops the immune response from getting out of control, and usually the T cells can eliminate bacteria just days after they have been activated. And at this point, your body can stop fighting and you'll start to feel better. An acquired immune is also a specific immunity because it's tailored to attack a specific antigen previously encountered. Its hallmarks are the ability to learn, adapt, and remember. Acquired immunity takes time to develop after the first exposure of the new antigen. So let's move on and talk about self-recognition and tolerance in the immune system. Antigens are found throughout the body and also in harmful pathogens, and are used by the immune system to signal whether it should attack or not, depending on whether the antigens are foreign or self. Foreign antigens are found in pathogens and will be remembered by B cells. Then they are recognized in the body, triggering antibody production when identified. All nucleated cells have a unique surface molecules that identify them as self. They are known as self markers, and named majority histocompatibility complex molecules, or MHC class 1. The immune system has a self-tolerance, which means it will not attack the cells with the MHC class 1 identification tags. Although in rare cases a person may develop an autoimmune disease, which occurs when the B or T cells become activated against self-antigens, but it isn't known why. Hypersensitivity is the occurrence of an abnormal immune response caused by repeated exposure to a particular antigen. Hypersensitivity disease can be grouped based on their underlying causes, as seen on the slide with some examples. So, immediate type 1 hypersensitivity is one of them, and antibodies medicated type 2, and immune complex mediated type 3, and cell mediated type 4. Autoimmune disease can occur all over the body and cause fatigue, muscle aches, low fever, inflammation, and this is a long-term condition that causes pain, swelling, and stiffness in the joints. Rheumatoid arthritis is one of them, and these are more common autoimmune disease described by the NHS. The condition usually affects the hands, feet, and wrists, and there is no known cure for rheumatoid arthritis, but symptoms are treated with medication and supportive therapy such as physiotherapy. Surgery is also an option for correction of the joints problems, and it is believed that women and smokers have increased risks of triggering the autoimmune disease, as well as people who have a family history of the autoimmune disease. Now we're going to take a look at an organ transplant. An organ transplant is carried out to correct an organ malfunction with the healthy organ given by a donor. It is often a life-saving production. Unfortunately, sometimes the immune system does not always accept the donor organ. Viewing it as a foreign agent, the process that follows is known as a rejection of the transplant organs. As discussed earlier in the presentation, the immune system can recognize antigens on the surface of the cells as foreign or self. In this case, it may innate and attack. To improve the chances that the body will accept the new organ, physicians will try to closely match both the organ donor and the recipient using a production of called tissue typing. A medication containing monoclonal antibodies is also used and after surgery to fight off specific T cells known to cause rejection. And if rejection does occur, it will be as one of the three types shown on the slide. The most rejection seen is an acute. All recipients will experience some amount of acute rejection, and an example of hyperacute rejection would be if the recipient was given the wrong blood type. In the final section of this presentation, we will take a look at understanding the biologically of a vaccination. Now we're going to talk about a vaccination. What is a vaccination? A vaccination is a biological preparation that includes active acquired immunity against a specific illness, infection, or illness. An infection often includes an agent that mimics a disease-causing bacterium, and it is frequently composed of weakened or destroyed variants of a microbe. Its toxins are one of its surfing proteins. NHS says vaccines teach the immune system how to create antibodies and protect the body from disease. It's much safer for you, and your immune system will have to learn through the vaccine and then by catching the disease and treating them. Once your immune system knows how to fight a disease, it can often protect you for many years. The vaccine will only include a weakened or harmless version of the pathogen, implying that the individual is not at risk of acquiring this specified disease. So if the individual becomes infected again against the same pathogen, the body will have the necessary white blood cells to reproduce quickly and destroy it. This is known as immunological memory. A primary response is known as the first time of encountering the pathogen. And this process of the antigen is also because B lymph nodes needs to identify it to produce an appropriate antibody, and by this time the pathogen has caused an infection to take hold, which leads to associated symptoms. A secondary response is when the same pathogen has come into contact, even if it was years later. The memory cells kicks in action, which leads to the body to produce high quantities of antibodies more quickly and for longer. Vaccines are used to start the creation of memory cells without infecting the patient. Vaccines is classified into several categories, and here are two vaccines. We have live vaccines and inactive vaccines. A live vaccine are derived from wild or disease-causing virus or bacteria in the laboratory. These wild viruses or bacteria are innated and weakened, generally by repeated culture. Live attended vaccines must multiply in vaccinated individuals in order to provoke an immunological response. And once the live vaccine is used, they are given out in much smaller doses of the virus or bacteria, which replicates in the body, producing enough virus and bacteria to provoke the immunological response. And inactivated vaccines are made by growing bacteria or viruses in culture media and then inactivating them, then using heat and chemicals, because inactivated vaccines are living and they cannot multiply. As a result, these vaccines cannot introduce illness through infection, and inactivated vaccines tend to require multiple doses, so this means that the first dose does not produce protective immunity, and a protective immunity response develops after the third or the second dose. Before the introduction of the vaccinations, childhood deaths were very common, especially from disease such as measles, polio, or whooping cough. Although the diseases still exist to the present day, we now have vaccinations that provide greater protection from them. So let's move on and talk about the major diseases which led to many deaths during the 1940s to the late 1960s. The measles first developed in 1796. Measles is a highly infectious viral disease which can lead to serious complications such as pneumonia and encephalitis, inflammation on the brain. We are now going to have a look at the chart. And this is the chart. And it just shows us the death rates from 1940s to 1994. And the measles vaccination started here. So as we can see here, the highest death rate, and it fluctuated between the 1940s and the late 1960s. And by the late 1960s, we have our first vaccine, where this also protects us against mumps and rubella. These three vaccines were combined into the MMR vaccine by Dr. Maurice Hilleman in 1971. If we take another look at the chart, the death rates only started to decrease by the 1970s, and now to present day there has only been one death, and this proves that the vaccine has been a success. Newborn babies have antibodies passed on to their mother at birth, and this helps to protect them for a short time against measles, mumps and rubella. So once the baby has become at least 1 year old, the antibodies are almost gone, and the MMR vaccine will be effective. And the second dose is given to a child aged 3 and 4 months old. Before a child starts school, and having both doses gives long-lasting protection against measles, mumps and rubella. Herd immunity is a scientific term for describing the point of which a population is protected from disease, even by enough people being vaccinated or by people who have developed antibodies by having the disease. Take measles, for example. The World Health Organization says a herd immunity for measles has reached at least 95% of the population vaccinated, meaning that the other half, the 5%, will be protected because the vaccination is hampered and its spread. Some infections and illnesses can be effectively controlled through herd immunity, and in a specific population it is especially important for safeguarding those who cannot be vaccinated, such as children who are too young to be vaccinated. The NHS offer vaccinations to children under 1 and children ages between 1 to 15. The NHS also vaccinations for certain adult groups such as the disabled, the immunocompromised, and the vaccination is for against influenza such as the flu. And there are several immunisation programmes in the country for both children and adults to ensure that the uptake is easy and comfortable as possible. This demonstrates by the availability of the National NHS Immunisations Programme for children. Other variables can jeopardise the success of the vaccination programmes, and this is aimed to protect the public. The efficiency of the vaccination programme is hampered by anti-vaxxers groups' refusal to take part in the programme, and some adults find it hard and difficult to attend clinic appointments to be vaccinated due to employment responsibilities and home life. Thank you for listening to this presentation.